First thing we're going to be assessing is active range of motion and lumbar flexion. The fulcrum is going to be placed on the iliac crest, and then the moving arm is going to be on the mid-axillary line of the trunk, and then the stationary arm is going to be in between the ACES and the PSIS. And go ahead and I'm going to have the patient touch her toes, and I will be measuring the flexion in the hip, and normal range of motion will be 60 degrees. All right. Okay, now we'll be performing anterior glide of the right innominate, and the patient is going to be laying on her side while her chest is going to be rotated onto the surface. I'm going to get her bottom leg and place it onto my hip while extended. And I'll take my right arm and place it on her PSIS, and my left arm and lock hands. I'm going to anteriorly extend her hip until I reach a firm infield. And I'm also going to test this bilaterally. Okay, now I'm going to be assessing manual muscle test for lumbar rotation. My patient is going to have her hands to her side, and I'm going to be stabilizing at her feet. She's going to raise up and put one shoulder to the opposite knee. Okay. And this test is going to be performed bilaterally, so she's going to do it to the opposite side. Okay, and my patient was able to perform this test successfully, and the muscles that were tested were the external obliques and the internal obliques. Okay, next assessment I will be performing is the squeeze test. My patient's hips will be flexed at 45 degrees and her knees will be flexed at 90 degrees. I'm going to place my fist in between her knees, and she's going to squeeze as hard as she can. Okay, relax. Positive signs of this test is pain and weakness in the groin area. Specificity is 91 and sensitivity is 43. Therefore, this test is good for ruling in pelvic instability. Next, I will be assessing the slump test. My patient is going to slump her thoracic and lumbar spine. Then I will bring slight pressure to her shoulders. Now she's going to bring her chin to her chest. And then if there's still no pain, I will apply light pressure to the back of her head. If there's still no pain, the patient will raise her leg. If there's still no pain, I will passively dorsiflex her foot. Positive signs for this test are increase in symptoms throughout the entire test. Sensitivity is 83 and specificity is 63. Therefore, this test is great for ruling out lumbar disc pathology. Okay, now I'm going to be palpating the inguinal ligament, which is in between the ACES and the pubic tubercle, right here. And in order to get a better feeling, the patient will raise that side of the leg, and there it will pop out a little bit more. All right. Okay. Now I'm going to be palpating the quadratus lumborum, and in order to get a better feeling there, I'm going to have the patient extend her trunk and then twist to her right side to get a better feeling on the right quadratus lumborum, and then twist to the left, and you will get a better feeling on that side as well.